one of the real difficulties is trying to figure out a way to tell a pretty big story to people who may work with us in one area and be totally unaware of the other things that we do.
In most rural communities, education and healthcare are the two biggest economic factors in those communities. And you're not going to find many businesses that want to move to a small rural community where there's no healthcare, where there's no education. So helping those communities survive is a great mission of ours.
We work with youth to get them interested in health careers, work with their teachers, work with their parents to put them on a path to college. We work with them in college to get them out of college. We work with them to really look at health professions. Then we work with their programs, medicine, nursing, physician assistant, optometry, pharmacy.
Okahec handles all northeast Oklahoma, which is 16 counties. Primarily, I'm in Miami, Tahlequah, Grove, Willika, the list goes on.
Our idea is basically to alleviate the primary care shortages in rural Oklahoma, and by putting the students into these clinical rural positions, it's hopes that they love it and they come back and they practice in these rural areas.
After having been in the rural setting, I love the sense of community that they have there. When I went out for dinner in Miami, Oklahoma, the pizza place it was on them that night because I'm a medical student visiting the town, it made me really feel like they appreciated me being there.
Once you get to school, everybody talks about the big super specialties, and that's kind of becomes more prestigious, and I think that sometimes an experience like that makes us stop and think like, okay, what's really good for us and our lives and what's important to us. And I feel like there's such a need, and I know that coming from a small town, you need doctors to come back. And this experience really just opens your eyes a little more.
If Northeast Okahec didn't help finance me in my programs, I don't think I would have. I don't think I would have got the information that I needed to help me decide that I want a profession in the healthcare field.
We're about rural, we're about underserved. We really try to work with minority students, poor students, students from small rural communities. We really do try to push our services, which are limited in terms of funding, into those communities that need it the most.